finally, your last lecture for this week's health assessment, genitourinary exam. We're going to start with the male genital assessment. So just the general anatomy of the penis and the scrotum, your testes, just some things to be familiar with, where the location of the bladder is. You see here your prostate gland. So if the prostate is enlarged, you can see where that's going to obstruct flow and cause symptoms with bladder obstruction or flow obstruction. Your penis, this is your urethra, and your testicle inside your scrotal sac. Epididymis coming up and around here, you can get an epididymitis, which is an infection into this area here. When some things to keep in mind: when it's cold, the muscles contract and raise the scrotal sac up, brings it closer to the body to absorb heat to keep the sperm viable. The left testes is normally lower than the right because the spermatic cord is longer, so that is not abnormal to see that. Also, some may or may not be circumcised, so they may or may not have a foreskin. It can be a cultural religious belief. It can prevent phimosis, which I'm going to talk about. Decrease the chance of inflammation of glands, penis, and the foreskin. Decreases incidence of cancer of the penis, and it decreases the incidence of urinary tract infections in infant boys. The vas deferens, which is here, coming down into the epididymis, transports the sperm from the epididymis to the ejaculatory ducts, and it is partially coiled tube, which exits the abdominal cavity through the inguinal canal. So a couple of disorders you will learn about later. Just want to mention them for assessment purposes, because the opening of the uterus, listen to me, the opening of the urethra can be on the upper surface above, called epispadias. This is considered the dorsal aspect of the penis, and this is the ventral surface of the penis. So dorsal is actually upper surface, epispadias, or the opening can be on the bottom, hypospadias. It can be to different degrees under here. They only do surgical repair if it's necessary, which should be covered in pediatrics. Sorry, didn't go to the next one. Phimosis and paraphimosis. You can see phimosis is where the foreskin is adhered. You cannot retract it. And paraphimosis is the foreskin is actually adhered below and cutting off circulation on the penis. Other testicular problems can be right here is torsion. This is a medical emergency. You see where it's actually twisted inside here. It can happen very suddenly at any age, and it is a medical emergency. Another is the undescended testicle. It's called cryptorchidism. I think I have that term, pretty sure I put that term on your terminology end of this. About 5 out of every 100 boys can be born with this cryptorchidism, where the testicle does not descend after birth. It is more common in premature baby boys. And if the testicle does not descend by 6 to 12 months, they do surgery to preserve fertility, because this will kill the sperm. And men with a history of an undescended testes have about a 10 times greater chance of testicular cancer. That is why that is a pertinent question in your history, and also teaching to do a testicular exam because testicular cancer is more common in the ages of 20 to 40, or actually in the lower end of 20. They're most at risk. Another I don't have a picture of is orchitis, which is inflammation of the testes, which is usually due to mumps. Hopefully people got the MMR and aren't going to get mumps. Some more issues is a hydrocele, which is fluid surrounding the testes. It can be on either side. And varicocele, which you can see here, where the spermatic cord is tortuous, all twisted up, and varicose, inflamed, swollen vessels. Okay, so teaching to do, like you teach the self-breast exam, you should teach them young boys, teenagers, to do testicular exams, monthly self-exams, and this is a picture of how to do that. When you do your checkoffs, I expect you to have an understanding of this and doing this exam. Subjective data, urinary frequency, urgency. Is this a change? How often has it gotten worse? Nocturia, do they have to get up and urinate at night, especially an older man with prostate issues? You ask them how many times do they get up and urinate. Is there pain, burning when they urinate? Is it difficult to start the stream or stop the stream? What's the urine color? Is there blood in the urine? Is it dark? Is it foul? Do they have any pains or sores on their penis? Do they have any history of sexually transmitted infections? Have they been exposed to somebody with that? Ask about sexual partners, practices, if they're using any barriers. Do they have any penile discharge, any erectile dysfunction problems, any surgeries? Have they had the history like earlier with cryptocortism, where they're undescended testes, because that increases their risk of testicular cancer? Do they have any history of any GU problems, GU surgeries, genitourinary self-care? Are they doing the testicular exams if they're an older man? When was their last prostate exam and their prostate level? Okay, now we're going to touch on the female genitourinary system. We're not going to cover that much because it is covered when you do your family nursing course. Again, this is the same in the male as your kidneys. You have female, you have your ureters coming down on the right and the left to your bladder and your urethra. Of course, your uterus is sitting in there. Food, we're going over that. So your subjective, asking about menstrual period. When did it start? How often is it? How frequent? Have they stopped? Have they become irregular? Is it very heavy, very light? Is any chance that they are pregnant? Have they had pregnancies? How many? That can go into surgeries if they've had C-sections. Do they have any problems with urination? Again, starting the stream, stopping the stream, holding it, urinary leakage. What color is their, I didn't put that in here. The color of the urine. Is there blood in the urine? Pain, burning with urination. Dysuria, which is painful urination. Have they noticed an odor? Any kind of vaginal discharge from their sores or lesions in the genital area? Are they sexually active? Are they having intercourse? Are they using barriers or in contraception? Have they been exposed to sexually transmitted infections? Have they ever had any? Are they any kind of hormones? Any medications for their bladder, for other medications that may affect genitourinary? Family history, is there family history of genital cancer, cervical cancer, HPV infections, self-care, their last pap smear? Have they gone for GYN exams? Have they gotten HPV vaccine, different vaccinations? And terminology that we did not cover: adnexa are the ovaries and fallopian tubes. Amenorrhea is absence of menstruation. Cystocele is a prolapse of the urinary bladder, where actually you can see the bladder coming down into the vagina. The dysuria is painful urination. Hematuria is blood in the urine. Hysterectomy is a surgical removal of the uterus. I say that, but it's just the uterus. People think hysterectomy. If they had a partial hysterectomy, they don't do that anymore, but they did for many years, did partial hysterectomy, so they left the cervix in, but removed the uterus. Now they take the whole thing out, and oophorectomy is when they remove the ovaries. I didn't put that term on here, but you should know that. Menarche is the beginning, what is their first menstruation. When you ask about their last menstrual cycle, you will ask them what was the first day of your last menstrual cycle. Menopause is when menstruation has stopped. A rectocele is prolapse of the rectum into the vagina, which can happen in older women, either one of those. Rectocele and cystocele, sometimes both. Vaginitis is an inflammation of the vagina, and the vulva is the external genitalia of the female. And that's the end of this lecture.